Hello. Thank you all for attending today the WiDS at AUB webinar. On behalf of the Olayan School of Business and AUB, I would like to welcome you all anywhere you are. I would like to especially welcome our two highly accomplished speakers, leaders in the field of data science in the region and around the world. We are very happy to have them with us, and I look forward to engaging discussions on the power of data science in the age of COVID-19. WITS at AUB aims to inspire, educate, and get educated in the field of data science. We are here to connect with pioneering data science experts, support women to join and contribute to the field, and learn about the opportunity data science presents in helping humanity navigate the path to recovery from this pandemic. The coronavirus has ignited the scientific community in ways that no other outbreak has before. The COVID-19 pandemic is creating large volumes of data which scientists are analyzing to track the disease, guide the response, and find the treatments. The COVID data is saving lives. AI and big data analytics are being used to battle the pandemic as they play an essential role across the whole life cycle of the outbreak, from building accurate models of the virus spread to disease predictions and treatment response. Machine learning algorithms are generating millions of therapeutic antibodies. Google's DeepMind AI system is being used to identify characteristics of the virus to help understand how it functions and work out treatments to pursue. Infectious diseases have always coexisted with humankind, but we have never been as well equipped to deal with it. We still have much to learn about COVID-19 that will accelerate the transformation of our world. Data will inform better response to the crisis. Senior executives will need to adjust their business strategies and operational plans. Banks will need to rethink credit models and manufacturers to reconfigure supply chains. Chief data officers must work alongside executives to identify and drive the new priorities. We live in challenging times, but with the right data and the right science, we can make a difference. I invite you to enjoy the talks and will pass the floor to my colleague, Dr. Huda Daw, who will give us an overview about today's discussion and introduce our speakers.
Thank you, Lema, for the wonderful introduction. And thank you, everyone, for joining us in this webinar. We were hoping to all be physically present together, but we are surely glad to be hosting this event online. During the past year, there has been a lot of focus on building data science applications for social good. Well, with the current events, such target has been amplified to achieve a much greater impact, contain pandemics, and save people's lives. COVID-19 has shown us that we as human beings are very vulnerable. It has put the whole world on pause, shattered global economy, and compromised the physical and mental well-being of many individuals. But the one thing we learned, and we keep learning every day, is that with accurate data and proper strategies, together we can beat this. Whether it's about determining the source, tracing contact and exposure, tracking spread, and predicting the famous curve, every day we are digesting and analyzing new data points. Well, what better purpose than to use this data to build smart algorithms to help control the pandemic and improve people's lives? Our talks today start with discussing targeted healthcare applications, and our first speaker is Zinat Patravala. Zinat is currently on the business and partner development team at Google Health and prior at Google Brain. She has been instrumental in driving forward the healthcare initiative at Google to provide best-in-class machine learning tools to a host of healthcare applications. Zinat also serves on the board of the Northern California Club of MIT and is an advisor to many companies in the healthcare space. She is joining us from San Francisco and will be sharing with us different use cases of how data science and technology are playing a critical role in the global pandemic. Well, at a micro-level scale, we can definitely see the benefit of each initiative. However, with pandemics, we need to look at the global picture. We need to benefit from the fact that we have so many distributed initiatives happening all over the world. each one leveraging specific skills and proper tools and valuable data sets. In my course on big data, and I know many of my students are listening to me now and can relate, I always say that in distributed systems, it's about divide and conquer, and that's the art of war. Well, here, in this current war we are all in, I would say the optimal strategy is unite and conquer. To conquer this pandemic and to conquer this pandemic and to amplify our efforts, we need to devise a strategy, a model, a pipeline that is able to orchestrate all these initiatives and drive them to their full potential. We will be hearing from Dr. Eva Marie on how to develop such strategy. And Dr. Eva Marie has over 15 years of experience in innovation and leadership. She is currently Chief Data Scientist and the Analytics and AI Practice Leader for GBS IBM. Her passion and drive are key elements in leading the analytics and AI practice, as well as implementing sustainable, large-scale data science and AI projects globally. She has set up the Center of Excellence for Data Science in MEA and has significantly transformed IBM's go-to-market data science strategy. So we will start our talk today with Dinat, then Dr. Eva Marie will take over. Afterwards, I would like to note to our attendees that we will move to Q&A after both talks end, okay? Questions for the Q&A should be addressed to me, Hoda Daw, in the chat box, and the chat box will be activated at the end of the talks. So I will leave the floor to Zinat. Zinat, you can share your screen now.
Hi, everyone. Thank you so much, Hoda. Are you able to see my screen?
Are you sharing your slides with us?
I believe I am. Are you not able to see it?
Not yet. Maybe it's going to take a minute or two. Can you try again? Can you try again sharing your slides?
Of course. Apologies, everyone, for the technical difficulties. Obviously, the tech companies can't figure this out.
We have an expert here in the room. He's trying to figure it out. So hopefully, we have support. Hopefully, it will get cleared out. Can we do the talk without the slides? Do you think we can start without the slides?
Let me take another 30 seconds here. It'd be great to have the slides available.
You want to send it to us? Or
yeah, I'd be happy to do that. Hold on one second. Let me send you the slides.
yes. Can you send it to my email, please, Zinat? We're sorry, everyone, for the technical difficulties. I mean, we're connecting people from all over the world, different continents, and our internet here is not that reliable. So we're going to get this fixed in a few minutes.
Okay, wonderful, Hada. I just sent over the slides, and while we're waiting for the slides to get up and running here, thank you so much for the warm introduction. I'm really thrilled to be here and was really looking forward to joining your team in person. It's so nice to meet everyone. And yeah, just as a quick bio on myself, as we go through this talk, I'm really going to be focusing on the business side. I found my way into machine learning and artificial intelligence through a very different path. My background is not in data science. I'm actually by training on the biology side and an MBA in finance, and have spent my entire career, more or less in healthcare in a variety of different companies, from biopharma to investment banking and venture capital. So I'm coming into this with a very different lens, from the lens of developing healthcare products that have, a meaningful use and outcome behind it for global patients. So I'm very excited about the intersection of these two industries. And, as we go through my talk, have really picked out use cases during this, at least here in the US, this 6 weeks of COVID-19 quarantine and pandemic, and how different companies and different institutions are thinking very thoughtfully about how to combat this pandemic, from therapeutics to diagnostics, to even ways of containment strategies. So looking forward to having this conversation with you. Oh, wonderful. So Hada, I will just say next when I'm done with each of these slides. So please go to the next one. The first use case that I'm looking to discuss here with everyone is around a company that I'm an advisor and investor to, SwipeSense. So prior to COVID, SwipeSense had a very simple mission, which has become quite important here, during the time frame of COVID-19. They had developed a device called the hand hygiene device. And the goal they had was to help monitor hand washing of hospital workers from the entire care team throughout the hospital. So one of the insights that they found through a lot of statistical analysis is that hand washing has a direct correlation with hospital-acquired infectious disease within hospitals. And with the new regulation here in the United States about 10 years ago, hospitals were having, both fines and, institutional pressure to ensure that when they discharge patients, that patients at that point were able to leave the hospital, had strong outcomes to whatever their disease profile was, and, was deemed healthy in the fact that they did not acquire hospital-acquired infections while there and were not admitted back in the hospital in a 30-day period. So it's called a 30-day readmission. So that was the initial evolution of SwipeSense. And, this has clearly become a very powerful tool as we're thinking about COVID spread and contamination within both the hospital setting and kind of the general real world environment that we're living in. Next, please. So just to give you, a quick background on SwipeSense, they have a suite of products, both from the device that sits, on site within the hospital centers, actually right where the physician and nurse staff and entire hospital staff washes their hands. And they also have, with that connected device, intelligent algorithms and applications that provide real world data and real-time data to help the hospital admins and the actual real-time workers kind of gear their behavior and tactics to ensure that the hospital-acquired infections within the hospital are reduced. So they've sort of had, over the last 5 or 6 years, a lot of traction within the US market hospital system, really pushing their tool forward and being a key partner and player with the CIO and C-level team at a lot of large hospital centers. Next, please. So, this is just a schematic here to give everybody, a sense of what this connected device looks like. So there's an actual tag within each of the hospital employees. It matches that individual tag to the hygiene sensor that is located at the station, we'll call it, the hand washing station. There's a location hubs throughout the hospital that monitor all of this real-time data. And the device senses every staff member and can provide real-time data for the entire hospital system, and can really specialize in providing information on outbreaks or containment issues in each specific area. You can really kind of begin to fine tune and provide real-time actionable processes and protocols on the spot of kind of outbreaks. Next, please. Yeah, so this is just a sense where you can have a digital map of the hospital center, and it can be an asset for the hospital for both the staff, and also you can think about how this could translate into the equipment. So one of the things that we can think of in the era of COVID is both COVID-19 and the spread amongst humans, but also amongst the equipment, as this virus itself has a long shelf life on counters and physical settings. Next, please. So and then the technology piece of this, the data science piece of it, is how do you make these insights actionable, and how do you actually have UI UX formats that enable laymen, we'll call them non-technology people, to actually take this information and have actionable feedback in real time. So they have a really nice and unique dashboards and notification centers to help with this location data. Oh, next, please. So, in the era of COVID, one of the things that's been really interesting from a data science perspective is how the data, the influx of data and the shift in data has provided new insights, and that the team has been rapidly collecting and providing, and kind of gives us a new framework of how we think about these products, both from a business standpoint, from kind of a global public health standpoint, and what processes and procedures we need to put in place, and also additional questions around how is a setting we're going to be thinking about monitoring health throughout the world, and how that takes into place individual health data, and what will and won't be requirements. And these are a lot of ethical questions. So let's start with the first one. What in the last 6 to 8 weeks, what new data findings have we seen, throughout the analytics and data sets that SwipeSense has been collecting through their hand hygiene tool? So the first question that came about was, hand hygiene. Has COVID-19, fundamentally changed, behavior of hospital workers, and what does the data tell us? So the data has told us that there's almost a 2 to 3x increase in individual hand washing, and the number of times that hospital workers are washing their hands. And what does this mean? I mean, I think one of the biggest insights that we've taken from this is, irrespective of profession, when your own impact, when your own health is on the line, and there's a direct impact on the self, that the ability to put in structures and to be compliant on these procedures, such as hand washing, increases dramatically. And so that's what we're seeing, because the individuals are not just concerned for external patients or external contamination. They're also concerned for their own health. We've seen an increase in hand washing. So that's been a key insight from a behavioral change perspective. The second part of SwipeSense kind of business proposition here is contact tracing, and monitoring tools that drive efficiency. So one of the things that we've learned is that one single individual exposure to COVID-19 can spread 25x, meaning that 25 hospital workers could be infected from that one exposure, and that could immediately mean 25 hospital workers that can no longer be on the front lines and need to go into self-quarantine. So that's a huge impact on the labor force within the hospital systems, which both here in the U.S. and globally, we're at a short staff situation as it is. The ability for the reporting of the hand hygiene device and NERT Insight and automatic track tracing allows for quick reports and kind of an hour-by-hour information where the web-based dashboards provide room-level data for every department, unit, and staff member, and therefore we can really begin to localize our efforts and understand where the containment centers and act accordingly. The contact tracing data is also valuable in determining if medical equipment came into contact with an infected staff member or patient. So through these, what's called an RFID asset tags that are attached to the mobile equipment, such as ventilators, the SwipeSet asset tracking application allows a hospital to virtually map and track assets throughout a facility or across a health system. And therefore, this room-level data about when and where an asset was used can help drive immediate sanitation or removal of that asset. So really precision medicine in play, and really precision and actionable processes can be put in place. So for this last question, what does this mean for the future of personal health data? And what will be the global expectations of contact tracing and hygiene information in the future? And how will we consider, public versus private records? And how closely do we want to monitor, for instance, high density population? I think we fundamentally believe that this will open up a lot of questions that will take, a lot of work from business leaders, regulators, government officials, et cetera, to really think thoughtfully about these questions. So for instance, are we okay with making personal health information public? How do you think about high dense areas? What kind of information would you need to ensure that those locations are safe, and what infection diseases would look like, in specific spread? What does it mean for, some of our service providers? So one of the things that we've seen is that since we're all in self-isolation or in our homes, it's enabled for a lot of services like food delivery, package delivery, et cetera, to be the main source of acquiring key services that you need to perform in day-to-day life. How will we evaluate any of the health risks there? What kind of processes and procedures will we put in place? So these are the key questions that are being asked today. Next slide, please. I just wanted to showcase here, the smart tags of SwipeSense has really kind of, elevated to the forefront of the public mindset here in the U.S. And here are just a couple of snippets from kind of public and public domain information as to how it's being utilized. One of the areas that we can all say collectively is that technology has been a slower adoption for specific industries, that being healthcare. And one of the benefits that's come out of, a horrific global pandemic is that it's been a great opportunity to have true collaboration, both on a localized level and a global level. I thought this was a great quote. The difficulty in getting hospital leaders to change their thinking. There's a time for competition and a time for cooperation. A pandemic is a really good time for cooperation. Next slide, please. My second use case and my last use case here is on a Duke University Margolis Center for Health Policy paper and publication around the recommendation and the thought process around a national surveillance program for future use cases around pandemic monitoring and to ensure public health and public safety. Next, please. So there's 4 key principles of this national surveillance system to achieve containment. The first one is test and trace infrastructure capacity, and really sort of focusing on diagnostics and data sharing. So far in the US, not one of our 50 US states has a surveillance capabilities sufficient to enable case-based interventions at the scale that we need to really combat this pandemic. Diagnostics at this point is really the ultimate goal, should be that all patients with COVID-19 symptoms seeking both outpatient or hospital care can receive reliable tests. This could really be kind of a core machine learning use case around identifying those that are the most at risk. What is the infection rate, and really identifying what is the risk of a specific individual or group setting in getting COVID. What is the severity risk? How early in the patient journey do we want to pull these patients in? And outcome risk. What is the risk that a specific treatment will be ineffective for certain individuals or groups, and how likely, are they to suffer severe consequences or mortality from this? And there's been some key kind of collaborations in the space. One being in Massachusetts, the Baker Political Collaboration in partnership with Partner in Health, a hospital system, to really come up with a community tracing collaboration. There's also we've seen a lot of speed in diagnostic tests and antibody tests being developed. I've kind of highlighted one out of MIT, E25 Bio. The second principle for a national surveillance system would be syndromic surveillance, and which means real-time monitoring of symptoms for all COVID patients. And once again, the principle would be to pull them earlier in the patient journey. The next principle is serological testing, which is the definition of that is more or less antibody testing. And really understanding the background rate of immunity in different populations and geography. At a population level, a vigorous, large-scale community sero survey is urgently required to understand the true extent of COVID-19 infections, which is important just in terms of understanding the epidemiology of the disease and once again, rapid interventions. And then lastly is rapid response, isolation, contact tracing, quarantine, really having real-time information as to when which type of program is required and for what length of time. And we could really see in the future the use of wearable technologies and providing a lot of really important data sets and analytics to help us make those type of informed decisions. Those are the use cases that I presented. Thank you so much for the opportunity. I look forward to your questions. And I'm going to pass it back over to you, Hada.
Thank you so much, Dina. This is really, really very interesting, and it's nice to see such, initiatives being happening at your end, actually, mostly in the US. And here we talk about different levels. We talk about prevention, we talk about diagnostics, and then lastly, intervention and response. And all these different initiatives tackle one aspect of this pandemic, of this COVID-19. And you mentioned something very interesting in your presentation, is that this is the global level. At the global level of pandemics, this is a time for cooperation. And when we highlight this time for cooperation, I'm going to leave the floor to Dr. Eva to go through her talk. Okay. So Eva, are you able to share your screen? Where Eva will focus more on the strategy on how to unite such initiatives towards reaching their full potential.
Good evening, everybody. I also have my screen sharing button disabled, so if you would share the deck for me, that'd be awesome. Ah, wonderful, I can share my screen. Can you see my screen?
Yes.
Perfect. So yeah, thank you everyone. Thank you to AUB for the opportunities to speak and present today. I'm very excited about it. Thank you for everyone in the audience. I am the analytics and AI practice leader for IBM in MEA, and I'm normally based out of Dubai. And I have over probably, more than 15 years of experience in data science and data science projects, a long time before it was called data science. And over the years, we are actually now at the most exciting time period ever. In the last few years, we've had massive advantage when it came to technology, when it came to algorithms, and the amount of data collected. But the big problem that we have is when you ask chief data officer, CEOs, and so on, are you actually happy with the results? The reality is not always. And that's why I kind of decided I'll talk about my experience and what I've seen. Why does it fail? Why what is missing? So that's why I call it the broken promise, because we haven't fully achieved the potential that we are there. There was a study a couple of years ago when they asked CEOs and decision makers in their are you becoming a data driven? Are you planning to be a data insights driven company? And over 99% of all the people they asked were like, yes, of course, we're completely changing how we're operating. We hire data scientists, we made investments, and so on. But then they asked the second question, and the second question was, are you actually happy? Are you successful with the insights you get? And that picture was a complete different one. So it was maximum a third who are actually saying, yes, we are kind of like seeing a positive return on investment. So that was when we looked at businesses. But then actually with the COVID crisis, a lot of the governments were surprised by the impact. So when you say the corporates, they weren't ready. The corporates don't see them being successful. What about the governments and the international bodies? And when I speak to them, I hear a lot of feedback on like, actually, we have not really an overview on what's going on. We're missing pieces. We are not having the impact from data science and AI that we wish we could have. And the main reason for that is that data science is not just about data or technology, about smart algorithms and so on. But it's actually the most important piece is to have a strategy and a clear execution on what you're doing and why you're doing. One of the definitions I like for what strategy actually means is by a guy called Ganavor, who wrote a article about strategy in war. And it says strategy is a purposeful orientation towards success in a complex competitive conflict. We are in a complex competitive conflict at the moment, and I think nobody doubts that. The COVID-19 crisis has many different aspects. We are trying to fight it. We're trying to make life livable still without having too many infected cases. But exactly that trade-off is the question on what is actually success at the moment. And most regions, most governments, most people involved have actually a different understanding of what is success. And we need to understand and align the difference in that. And only then we can have a purposeful orientation towards success. When we talk about corporates and we have a vision and we say we want to build a smart car, that is our definition of success. This is our goal. We really want to head towards something like that. Then, on the other hand, everything we can do towards building that car, and similar in data science, is heading towards that goal and is aligned with that. So we have the perfect tire, we have the perfect engine for that perfect purpose. And that is what a government actually needs to do to make decisions. So that's what we need to have, not just a toolbox of bits and pieces, but they have to fit together and work together. Sorry. Because otherwise, and that's the situation we're currently in, is we have lots and lots of amazing use cases. We have the smartest cars, the tires coming up. We have the best steering wheel coming up. But all the pieces, they actually don't really fit together. And this is not the situation we want. We want to have a situation with a clear strategy, a clear goal, so that we can have, as I said, a purposeful orientation towards success. One of the biggest problems we have at the moment with that missing strategy is that the data we're making decision on are a complete mess. In an ideal world, you would have something that similar to what we have on the left-hand side, where we have reviewed, organized data, categorized, we can find it, we can easily combine it, and so on. We have a catalog of knowledge. The reality is actually not the right-hand side. The reality is much worse than the right-hand side. It's not even in books anymore. We have, with the data collection, for example, at the moment, every region, every hospital collects the information differently. And that way we can't combine it. So in all the models that we see, we have massive uncertainty, massive variance. So there might be a hospital that only tests if somebody is really sick, and they're nearly 90% certain that this person is COVID-19 positive. And when that person, so that hospital actually will end up reporting a high success rate on this is the number we tested, and this is the number who was positive. That doesn't need to mean that it's a highly infected area. It only means they're really diligent or they're really strict in who they measure and who not. And this uncertainty in data then goes into dashboards we have to make decisions on, but these decisions are difficult to really base something on it. For example, we say that something between 5 and 85% of all infected people are actually asymptomatic spreader, sorry. and when you have a number that is somewhere between 5 and 85%, how are you going to model forward the assumption on how many infected people do you have in 2 weeks? So no matter how good your algorithms might be, with the data that you put inside, the outcome is too spread, too uncertain. We also have, for example, in the news today, for you who followed it, New York City announced that they probably have 21% of all this population being infected. And this is a number that surprised everybody. And so the question is, what change in testing? And is that actually the assumption that is, and the change in testing and reporting, is that something you have to roll out through the whole of US? For the decision maker, for the government, you have to really ask, what are the decisions you have to make, and what do you need to know to make them? So I liked what Sinat was saying earlier, is categorize it, and what is prevention, what is diagnostical, and what is response. And have a top-down approach and saying, this is my plan, this is my strategy, this is the decision I want to make, and these are the underlying things that I can have, that I need, my toolbox. So that you have your track and trace solution, for example, you have your hospital capacity planning, you have your release planning, all the different models and strategies or sub-strategies you can build and put them together in an overall picture. Because otherwise we'll just end up in a race around algorithm that might not make sense. But you need to have the plan. The other thing we often see is with corporates, and also at the moment, they're trying to look for unicorns. They're trying to say, okay, we have a really smart person, they're talented data scientist, we use them as a data engineer as well, we use them as a medical healthcare specialist at the moment, and so on. And that doesn't work. You have to have a team of experts with the right domain knowledge. I have seen a lot of interesting models in the past of using fancy filters, fancy algorithms to predict infections and so on, which have nothing to do with the reality on how infections are spreading. So just because the model fits the outcome doesn't mean it makes it right and will actually match it going forward. We can't have a run for the best algorithm. We have to have medical experts, for example, healthcare experts, machine learning algorithm experts in optimization, and a project manager. And only then the use cases you define in your roadmap that you want to have can develop their full impact. One of the things that I also see at the moment is everyone is so busy firefighting that we're jumping at amazing POCs, at amazing ad hoc solutions. But the scary thing about the climate is we're in this for the long run. There are discussions about this just being the first pandemic. There are questions about how many cycles we're going through and so on. So we need a long-term strategy and not just this grabbing this and grabbing that. And I want to leave it today with a quote from Yoda: do or do not. There is no try. And that is the most important thing at the moment. We are in a very serious situation and we have to get this right. And we have to get the right strategy in place, the right people in place, and the right tools in place to actually manage this going forward. Thank you. I'll give it back to Ola.
Thank you. Thank you so much, Dr. Eva, for this wonderful talk. Definitely very, very insightful. We're going to open the floor for Q&A. So please, when you type in your questions in the chat box, address them to me. So because I will be moderating the questions. So, and I would like to start a few questions since we're waiting now. And I would like to address my first question to Zinat. And I know, Zinat, you spoke about behavior change of hospital workers when you were talking about swipe sense. So do you see now, or can you project this behavior change in different individuals, not just hospital workers, especially with everything we're going through right now? You're on mute. Zinat, you're on mute. Yes.
Hi, I'm sorry. Can you hear me now?
Yes, yes.
Yeah, no, it's a great question. So, you know, the data hasn't been extrapolated or sort of overlaid on a population setting yet. So there's no analytics right now to support or defend what this will look like in the general population. So, you know, that's the first thing. All this data is sort of specific to and collected by in the hospital. So you have a very kind of inclusive criteria base. Now, you know, to answer your second question, what will this look like? What will this do in terms of behavioral change for the general individual, for the general Joe Schmo? I can only give a little bit of tidbits and my own personal insights. I don't have enough data to really defend any of these points. I think it's going to be a very society by society change and very unique to different cultures. So, for instance, there are cultures, and there's been quite a few interesting papers written about the pandemic and the curve in Japan, because the Japanese society, they tend to wear a lot of face masks. They tend not to go to work when they're sick. They have different cultural and social norms that may have, at some point flattened the curve or prevented the initial spike in COVID, the spread of COVID-19. There are other societies that in general have more, physical touch, whether hugging or kissing on the cheek. How we will change our behavior based on what's happened in COVID-19. It's yet to be seen.
I think we're getting more and more questions about this, actually. So I'll start with, Lina Rahbani. So how many hospitals do have these smart tracking systems installed and functioning?
Yeah, it's a great question. Unfortunately, SwipeSense doesn't disclose. They're a private company, so they don't disclose, in totality, how many hospitals are utilizing health hand hygiene and how many devices are within this hospital. What I can say, it's widely distributed across the U.S. On both coasts and in the Midwest. They have been able to capture the top tier hospital systems in the U.S. and rolled it out throughout all of their different localities. But unfortunately, that's all I can say.
Great. I understand that many of these questions handle, ethics and privacy side, and we don't want to go into specifics because there's lots of proprietary information, whether it's Zinat or Dr. Eva Marie, and these speakers cannot disclose such information. Okay, so I'm going to go over more questions. So here, to Zinat, Ali Taraf is asking, can you elaborate more on how you are using tech data to monitor and enhance hand washing habits at hospitals?
Yeah, I can actually. Hada, by any chance, let me see if I can.
If
I
not,
wasn't able to show my screen, was I?
I can share.
I may not have those slides available. So in terms of how they're using tech and data to monitor, I walked through the schematic of all the different RFIP tags that are within the hospital system. So they're tagging the individual. They're tagging. They have a device that has a tag associated with it. So when you wash your hand, it tags you and your real-time personality. There are location devices throughout every hall within the hospital. So it's monitoring movement and individual movement, where they're going, what room they're going to, etc. So they're monitoring, every movement. You can think about hand washing. You can think about location drivers, individual individual movement, time that you're spending in the hospital. All of that is being tracked, and then that real-time data is helping in developing hotspots or an understanding of where hospital-acquired infections are occurring based on this movement all around hand washing. The question that you're asking is, how is it enhancing hand washing habits? That's a great question. The device itself, and my understanding of what they've implemented so far in terms of features, is not driving any type of push notification to remind the individual to wash their hands that would, increase that habit. That being said, I don't know if there's any studies being done on the behavioral change of knowing that you're tagged and seeing that there's a hand washing device there, if that changes the habit of hand washing. I haven't looked at that data set.
Because I have another question by Adham Ajami. He is a behavioral data scientist with interest in data science, and he's asking, do swipe stands use any nudges to steer human behavior?
Yeah, great question. Not that I'm aware of, but that doesn't mean that they're not doing it. I'll have to get back to you on that.
Right. I have another question by Mariam Harfouch. So people are sending survey to employees to collect health data like body temperature. How do you think is this step efficient?
Eva, is that for me, or Eva, do you want to take that one as a?
You can take this question. Did you find this as an efficient step to do?
It is one step, but the problem is that, or the biggest problem that we have are the asymptomatic spreaders at the moment. And the asymptomatic spreaders, they have zero symptoms. So they can go around and infect as many people as they are in contact with, but they will show no temperature. And by not knowing that ratio and or the percentage of people who have no symptoms, and people saying it could be between 5 and 85%, we only tackle the people who have symptoms by measuring temperature, and that is normally 20 days too late as well. It's still better than nothing. It's still better to catch the people with the temperature than not to catch them, or to monitor them. But it's not all of it.
Thank you. Thank you for clarifying this. So, and this adds to the inaccuracies in the data that we need to be aware of.
Yeah.
So, and
yeah, I'll jump in there for a second, because I'd love to piggyback off of what Eva said. So, you know, I agree with everything that she said, that it doesn't capture the asymptomatic patients, which is probably the larger percentage of patients that are causing the spread of the disease. So I think along the patient journey, you know, each of these steps are pretty critical. So the temperature tracking is also enabling that we have full identity that that individual has COVID-19 and can get intervention and treatment on the spot. So they may not be an asymptomatic, and they may not be our pool of data that helps understand the spread and of the disease, but it is a critical point to get that patient in for care earlier in their progression of the disease, so that they can get the most effective care and have the best outcome possible for them.
I have a question from Andrew Schumer, and I think it's for everyone, and Zinat or Dr. Eva can answer. So how do you see change management playing a role in this strategy that you are describing? Doesn't this impact adaptability and the agile mindset by committing to one overall strategy?
So when I talk about strategy, I don't mean that a strategy has to be fixed. A strategy has to be adapted and reviewed. And especially in times of crisis and or unusual circumstances, for government as well as for corporate, now is the right time to actually sit down and review your strategy and saying a lot of things have changed. How are we dealing with it going forward? I like a quote that we use in car racing, for example: you overtake or you win in turns. And it's exactly that time of the crisis now where you have to reassess your strategy, be flexible about it, and build a strategy going forward adapted to the new situation that you're facing.
Zinat, would you like to add something to that from your experience?
Yeah, I guess I want to emphasize that when we talk about a global strategy here, we're not talking about an inflexible global strategy. I think we're talking about principles and guidelines that would benefit the global economy and the global population of being able to move rapidly when a pandemic happens. That kind of in its thought process provides the tools and the flexibility to change on the fly and to make, to change strategy. But I think what we've learned from this global pandemic is we really had such varying approaches. And, on some level, you could argue that we didn't have principles in place to really combat this as a world population.
So there's another question that I will take a few more questions. We cannot go over all the questions, so I'd like to apologize to our attendees. So there's a question about China. Okay, so by Hussein Islami. And can we attribute China's success in containing the COVID to its data analytics capabilities, hardware and software? What do you think about that?
I'm unfortunately, I'm not in a position to comment on China's approach because I don't have full visibility and don't have the expertise around everything that they did to combat this. My understanding, just from tidbits of information, is they took a containment approach and were able to very swiftly lock down the entire geographic location, and their ability to put up infrastructure, specifically hospital infrastructure, in a very short time frame was also very effective. But on the point of hardware and software and wearables, I'm not as familiar.
Do you have anything to add about that? It could be more general strategy in terms of how China coped or decided to cope with this pandemic.
So I think every country has their own strategy of coping with the pandemic, and we can look at the different European countries or compared to the different countries in the Middle East. It really depends on many of your factors, on what kind of setup your economy has. Where's your GDP coming from? What kind of demographics do you have? And so on, to be able to understand from a goal point of view, from the success view, how do you want to manage this? And then of course China has had a lot of different technologies, and I think every country has to decide by themselves on what are the things we want to copy and what are the things we are worried about, where we have concerns. So it really, I would look at China and take it apart and say, this was really good, this I can take, this would not work. For example, on the technology side, a lot of the countries don't have the technology set up to actually implement quickly measures that China has implemented very fast.
And add to that cultural differences and mentality differences and ethical. How do we see ethics? How to define ethics between different countries?
And ethics is actually something that is based on our values, and values come from our culture. So every single there is no global definition of ethics. So every single region has their own ethical viewpoint, and says where areas where they're happy to do it and the areas where they're concerned about.
I totally agree. So we have a question by our colleague here in the business school, Dr. Fida Afyouni. So she says, thank you for the great presentations. I was a bit alarmed to hear the word surveillance several times during the talks. Should we be concerned that big data might lead to more totalitarian states? Nobody's willing to answer that. We're thinking before we answer. This is definitely a very interesting question. Thank you, Fida, for asking this.
I can jump in and take a stab at it. So I think that there's a definition of the word and an implied meaning of what it means in different cultures. So I can fully appreciate that the word surveillance causes uncomfort in some people or some societies. It was not meant in that way. It was synonymous with tracing. It's a way for us to monitor and to ensure that it was that we can actually attack and prevent this pandemic. That type of program and process for this pandemic and the connection to a totalitarian government was not a connection I was trying to make. I have no way of being able to put those two things, in the same conversation. It's outside of my knowledge base.
So there is a lot of, especially when it comes to track and trace solutions, and the topic of surveillance is actually discussed a lot. And there are a lot of solutions being developed at the moment to actually protect your PIIs, your personal I don't know what's happening with me today. I can't say words. Personal identifiable information. That is what you have to protect. And the state-of-the-art solutions, even when they're track and trace, are actually built in a way that there's no interference, that your data is anonymized on both sides when it's connected, and there is hopefully very little room for misuse of the solutions.
Thank you. So thank you for your answers. I'm going to have to apologize to other attendees who asked questions, and we didn't have enough time to answer all these questions. I'm going to leave the floor to our colleague, Dr. Mariat Awad. But I would like to thank you so much, Eva and Jinat, for taking the time to do the presentation, especially with the time difference and now with everything that's happening. It's definitely not easy to organize, focus, and prepare such webinars. So we'd like to thank you for taking the time for this. Definitely, it was very interesting, and I see the comments of our attendees. Everybody loved your talks. And I will leave the floor to Mariette now. Yes.
Thank you.
So Mariette would like to announce a competition, and she will.
Thank you very much for inviting us.
Thank you.
And
Thank
thank
you
you
so
to the
much.
audience.
Yes, thank you so much.
Bye. Okay, great. Maria.
Yes, can we share the screen, please? Hello, everyone. So after this very interesting presentation about COVID and all the impact and the changes that's happening, it's also somehow related, the competition that we're going to announce here. We are at home, and most of our work is kind of going uninterrupted. It's because we have the commodity of electricity. So this okay, maybe we're running into some technical. Oh, okay. So the energy is very important. It's a commodity that we should have. And then one of the challenges okay, so I think by now the screen is shared, and I'm just going to go very briefly that this competition that we're announcing here is basically really to be able to apply data science, machine learning, and AI to really run in the power grid in a more automated and a more sustainable manner. And as I was saying, we're all home locked because of COVID, and many things are able to continue as pseudo-normal is because we have electricity. That's the source of many of our digital life now. So this competition is designed by institutions from three continents. Major institutions are involved. I'm listing here just alphabetically some of them. AUB is one of them. We're very proud to be helping in this competition. Google, Brain, INRA, University College of London, University of Kassel as well. The prizes would be up to 15,000 USD, and the announcements and the results obtained by the winners will be announced in December 2020. Hopefully by then it will be a physical conference, and it's the
famous NeurIPS, the 34th Conference on Neural Information Processing System. So this challenge is basically designed, and it started and was maintained by Isabelle Guillon, the famous co-inventor with Bernard Bozet and Vladimir Vapnik. So together, the three of them were really behind the support vector machine, which is a major and a very important machine learning and data science approach. Isabelle also is a very strong collaborator with Jan LeCun and Joshua Benchu. All of these names for us in machine learning and data science, we know we recognize them as being the big superstars. So what is this challenge about? So this year, it's going to take into consideration that this is a world challenge in a sustainable environment. So the grid size is large. There is a lot of stochasticity. There's a lot of unpredictable parameters coming from, sources that are traditional, the fossil fuel, and now we know that worldwide we have a big problem for that. And then also for renewable, the demand is fluctuating. So how can we look at this problem from a data science machine learning lens? So when you look at it, this is just a very simple screen of some of the visualization tools that network operator has to deal with. It's very complex. And this year, what we would like to do is to really have a solution that is powered by reinforcement learning. So reinforcement learning is one kind of machine learning tool where you model it as if an agent is just taking responses from the environment, and depending if it is positive or negative reward, if it's the right action or the wrong action, eventually the agent will learn inherently from the network to operate autonomously the network. So this is very high level, but of course, a lot of documentation and a lot of the code, the Grid2Op, which is a platform that is open source, because we believe that open source environments are very important to promote research and move the field forward. So there's a lot of information on the GitHub listed in this page, and the technical documentation for the Grid2Op. And there are additional white papers and much more details about the competition. So I really highlight the importance of it, and I encourage everyone to really participate and give it a try. So I thank you a lot. If you need to additional specifics about the competition, you can feel free to reach me. And of course, we look forward for a more interesting and a more challenging 2021 WiDS. And I think now Lama is going to share with us her concluding statements. Thank you so much for attending, and I look forward to a lot of participation.
Thank you, Mariette. In closing, I would like to thank many individuals who have been instrumental in planning and executing WiDS at AUB webinar, despite the difficulties and challenges we've faced. First, a shout out goes to WiDS Stanford, the entire team at Stanford, Margot, Judy, Valerie, and Karen. Thank you for the OSB deans. Thank you for the WiDS co-ambassadors, Dr. Huda Daw, Ms. Rasha Bouhsali. Thank you very much. You've put so much effort. I know you've been working days and nights to make this happen. Dr. Lina Daou, Dr. Mariette Awad. I would like to thank Ms. Kintia, head of the Office of Communication at OSB, and the entire team working with her, Diana and Diara. I would like to thank Ms. Nada Khalidi, head of the Office of Events at AUB at OSB. Thank you for Ms. Layan Sarkis, the WiDS coordinator. Finally, I want to say that a recording of the webinar will be available and will be sent out shortly to all attendees. And thank you everybody for attending. Thank you for your time. I hope you enjoyed the talks, and we look forward to WiDS at AUB 2021.